Hey guys, Dr. J here. Today we are going to change things up and we're going to talk a little bit about hypertension or high blood pressure. In the past, we've mainly been talking about things in our lifestyle that we could do to optimize our overall health and the importance of health and wellness. But today we're going to actually change it up and talk a little bit more about a specific disease. Hypertension is a very common disease. Remember, for anybody out there, that this is just general information and that anything specific to yourself or your own medical conditions, you should discuss with your own personal physician. For some of you, that might be me, but obviously everybody's personal situation is different, and this is just general information for people to learn about high blood pressure as an overall. So first of all, what is blood pressure and why do we have it? So, we don't like high blood pressure, but why do we have blood pressure at all? So blood pressure is actually the force that we need to move the oxygenated blood and nutrients from the heart out to the rest of the body. And if we don't have blood pressure, then we're not getting the blood flow that we need, propelling we don't have that force to propel the blood flow that we need to our organs. And actually, people with low blood pressure actually end up with damage to their organs due to that exact event. What makes up blood pressure are two numbers. You're going to have your top number is your systolic number. That is when the heart is beating. And the bottom number is your diastolic number. And that is when the heart is relaxed. You constantly need some pressure in the body, otherwise the circulatory system would collapse and you would have no blood flow at a point of time. So why is it important? Why should any of us care about high blood pressure? Well, it's probably one of the most common diseases out there. It does affect about 40% of adults during their lives, which is a pretty high number, which means almost about half the people you know will end up having high blood pressure. As well, because it's more of a silent disease, roughly 1/3 of people with high blood pressure aren't even aware that they have it. Therefore, it's really important to check in with your doctor and get a blood pressure check sporadically, because it could be silently creeping up on you without you ever being aware of it. Now that we kind of talked about what blood pressure is and how common it is, let's talk a little bit more about what is the definition of hypertension or high blood pressure. Well, we talked about blood pressure being the force of blood against the walls of the aorta, which is where the blood flow comes to when it leaves the heart. The heart has to work harder against higher pressures. A normal pressure is 120/80. An elevated systolic or top number is 120/129. Over 130 is considered high blood pressure. Over 80 on the bottom is considered hypertension. And I'm going to use hypertension and high blood pressure kind of interchangeably here. The definition of hypertension now is technically over 130/80. It used to be lower. It used to be 140/90. And a couple of years ago, they changed the definition. The reason that they changed the definition was realizing catching it earlier is probably better than catching it later. We don't necessarily need to treat these early hypertension people. These used to be called pre-hypertension before the guidelines changed. What it is important is, now that you have that diagnosis and being cognizant of it, maybe you can make some of those lifestyle changes or screen them to make sure that there is no evidence of damage to the body from hypertension. And we're going to talk a little bit more about diagnosing hypertension and how one spot number is not all it's meant out to be. So we kind of said it was a silent disease. So what are the symptoms of hypertension? For most people who walk into my office, you don't feel high blood pressure. It tends to not be felt until your pressures are very elevated, reaching up over the 180 to 190 range on the bottom and reaching over the 100 to 110, 180 to 190 range on the top and the 100 to 110 range on the bottom. At that point, you might feel some chest pain, shortness of breath, headache, and some people could get a bloody nose. So what are the types of hypertension? Are there different categories? And the answer is yes. There is the most common type of blood pressure, and that is primary hypertension. And for that, we don't really know what the cause is. It is some mix of your genetics and it is some mix of your environment that combine to affect what your blood pressure is going to be. And that's why some people live very unhealthy lifestyles and always have excellent blood pressure, and other people are fairly healthy but continue to have high blood pressure. That's that strong genetic component. And then the environmental component is how siblings, some could have high blood pressure and some might not have high blood pressure based on how their lifestyle is affecting them. And it's too hard to really know specifically what aspect and what person is going to be affected by lifestyle and which person is not going to be affected by lifestyle. For a much smaller group of people, there is something called secondary hypertension. And this is when there is an underlying medical condition that is creating the hypertension in you. So in this case, we actually are able to screen and figure out why you have high blood pressure. One of the more common causes is sleep apnea. Other things like kidney disease, such as people with chronic kidney disease, or people with a disease called renal artery stenosis, where your arteries that go to the kidneys are actually narrowed. There are congenital heart abnormalities that can create high blood pressure. As well, there are tumors that secrete hormones that can actually lead to high blood pressure. We kind of briefly mentioned this just a few seconds ago, but what are the risk factors of what are the risk factors of developing hypertension? Well, age, the older you get, the more common it is. Ethnicity, weight or obesity, a family history, is that genetic role, and then those environmental factors, such as if we're exercising or there are toxins, and we're going to talk a little bit more about that in a few minutes. So what risks does high blood pressure pose to us, right? So we talked about what are the risks for developing it, but you have high blood pressure, you're not really feeling it. It's not bothering you. You don't really care if you show up at my office and your blood pressure is 150 over 90. You're not aware of it. Never had that problem until you came and saw me. So why should we care? And why is that a big deal? So the reason that we should care is the elevated blood pressure is actually going to put a strain on our blood vessels and damage those blood vessels. And it pretty much puts blood vessels at risk. Because we have blood vessels all throughout the body, it's putting all of your body and all of your organs at risk, because anywhere where those blood vessels are going to feel the strain and the impact of that high blood pressure. So to put in perspective, if you have vessels that go to the heart, that high blood pressure could strain the vessels of the heart and cause a heart attack. If you have blood vessels going to the brain, it could cause a stroke. It could also expand the blood vessels because you're having an increased force. So imagine you're working with a higher force and pushing out blood flow higher, expanding those blood vessels. So the first blood vessel that we pump blood flow to, I said, is the aorta. That aorta could expand. That's called an aortic aneurysm. And some of you might have heard the term aortic aneurysm or aortic dissection, which is when your aorta expands so much that it actually rips and tears, and you have no blood flow going to their body and is critically dangerous and has a high fatality rate. You could have an aneurysm that goes to the brain, and once again, that could expand and rupture and cause a catastrophic brain bleed. So you see the impact that the blood pressure is having now on your heart and on your brain. As well, we have blood vessels that go to the kidneys that can lead to kidney disease. Blood vessels go to the eye, could lead to ophthalmic disease, and other vessels that we talked about with the brain, not quite as catastrophic as a stroke, are a slower process where you're having memory loss or a degree of dementia develop, and that's called vascular dementia because it's your vascular bed or your vessels going up to your brain that are having poor blood flow leading to dementia. In terms of the heart, you're also putting excess work and force on the heart. So the way I like to talk about blood pressure with the heart is blood pressure is the weight that you're lifting at the gym. So if you're at the gym, you want to be bench pressing 120 over 80, right? We want to not be working ourselves out too hard. And somebody out there might be going, what are you talking about, Dr. KARL? Well, the heart is a muscle. And like all muscles, when you work out a muscle, it gets bigger and thicker. And somebody out there is going, great, I want high blood pressure. I want to get my heart big and strong. Well, it's actually not true. So what happens with our heart, unlike, when we're going to the gym, we want to get our biceps big and strong and make ourselves look great. Our heart getting bigger and thicker actually becomes stiffer and it does not work as well. So one of the heart's jobs is to squeeze like a ring and relax and squeeze and relax. When we get stiffer in the heart, that relaxation doesn't work as well. And that relaxation is what sucks blood flow from the top chamber, sucking it down to the bottom chamber of the heart. So when we lose that function, we start to develop a degree of heart failure or a thickening of the heart called cardiomyopathy. And this could lead to fluid retention and shortness of breath. So we definitely do not want to be overworking our heart. We definitely do not want to be bench pressing 180 over 100, as that is a surefire way to overexert your heart and burn it out quicker. How do we figure out if you have hypertension? I kind of talked about main way is checking you for hypertension, seeing us in the office, a home blood pressure cuff. You could get a CVS, or just checking your blood pressure at like a screening place, like at a pharmacy or at one of these free screening clinics that you kind of see pop up in the community. You want to check your blood pressure more than once, as blood pressure can vary, and we're going to talk about that in a second. There's a lot of things that impact your blood pressure, so you don't want to label or give somebody a diagnosis of hypertension based on one moment in time. It should really be a conglomerate. And the reality is you see us in the office one day, maybe a few days a year for a momentary blood pressure check. That's really just like a very small step at a time of what the conglomerate of your overall blood pressure is, right? But we try to use it as a surrogate for what it is the rest of the time. You want to try to keep your arm at heart's height. So kind of try to keep it parallel to your heart. And ideally, you check two blood pressures in a quiet setting. In the real world, it's not always as easy to do that. So we try to mix it up between the medical assistant and the doctors in doing that. And that's usually for the first diagnosis of high blood pressure if you're labeling somebody with it. Certain activities will raise your blood pressure. So if you exercise, and we're going to talk about this a little bit more also, when you exercise, your blood pressure goes up because you need excess blood flow going to your extremities because your arms and legs are working harder. But after you exercise, that number will come down. Stress will definitely play a role in blood pressure. There is a medical diagnosis, which I kind of like to challenge, called white coat hypertension. And I love it when people come in and tell me that their blood pressure is just up because of my white coat. And my usual response to them is, I cannot be the scariest, most concerning thing in your world, and wearing a white coat definitely is probably not the scariest, most worrisome thing in the world. And that's not to insult anybody out there who has fear of seeing a doctor or or wearing or seeing us in a white coat. But it is to suggest that, other times in your life, you are going to have stressors. And if you're having stress cause high blood pressure, when you come and see us in a doctor's office, you're probably going to have stress increase your blood pressure at other times in your life as well. So I like to call it stress-induced hypertension as opposed to white coat hypertension. Kind of as I mentioned, there could be variable factors that make your blood pressure high. If we're concerned that maybe it is just stress-induced and the rest of your time your blood pressure is good, one of the things we could do is tell you to keep a home blood pressure log where you monitor your blood pressure. A lot of patients ask me if they should do this at a specific time. I tell them to go more variable because I don't want to know one moment in time once again. So I don't really care about 8 o'clock Monday through Sunday. I want to know 8 o'clock, 4 p.m., 1 p.m., 10 a.m., just various circumstances to get a sense on what might be causing your blood pressure to be variable. And then if there is variable times where it seems to be spiking and other times where it seems to be normal, then you can really look into and determine if there's something in your lifestyle, whether it's a stress or whether it's food or whatnot, that is triggering your blood pressure or lowering your blood pressure to help kind of guide us on what the best management style is. But it does take a little bit more diligence and really mapping out timeframes to get a better sense of that. Once we know you have high blood pressure, okay, we talked about some of those secondary causes above. So you could screen somebody if there's a concern for a secondary cause, such as sleep apnea. We might refer you for a sleep study. If we're worried about kidney disease, we could check your blood work for kidney problems or for hormonal issues. If you have high blood pressure, we can check the impacts of the kidney and the hypertension kind of go hand in hand. Kidney problems could cause hypertension, and hypertension could cause kidney problems. So we could check your urine and your blood work to see if there's any impact of hypertension on your kidneys. And you could see something called protein in your kidneys because they're not filtering as well once blood pressure starts affecting them. And we'll talk about the best drug for that moving forward. In EKG, probably the most common test that we do in our office, that's when we put the electrodes on your chest. We could see if the heart is getting bigger. And an echocardiogram checks also for that heart muscle thickness as well as the functioning of the heart. A less common test, or I shouldn't say less common test, a very common cardiac test, but less common to do for high blood pressure is a stress test where we walk you on the treadmill. I do like to do that test at times. So more commonly, we use that test for looking for blocked arteries in somebody that might be having chest pain or underlying coronary artery disease. But I do like to do that test at times for people on high blood pressure because some people have an accentuated or exaggerated blood pressure response to exercise. And I want to know if it's safe for them to be participating in exercise. So we're all supposed to raise our blood pressure while we exercise. But if you start raising your blood pressure to like the 220, 240 range, it starts becoming a little bit more problematic. And I have seen some people with reasonably good resting blood pressures that really jump up on exertion or exercise. And I decide that I might want to treat them for certain things to make sure it's safe for them to do certain activities without putting themselves at harm. So in review, we talked about what blood pressure is, risk factors for hypertension, how to diagnose it, what are the dangers of hypertension to our body, and the effect on our overall health. So hopefully you guys learned a little bit about the basics of hypertension there.